Hi, my name's Dr. Alex Phoon. I'm a plastic surgeon from Sydney's Park Clinic Plastic Surgery, and today I'm going to be talking about the procedure of a tummy tuck. So what actually happens surgically. So a tummy tuck involves, as we've talked about earlier episodes of this series, taking away the skin and the fat from the area of your lower tummy, as well as tightening up the muscles. Now, what specifically that means is a general anesthetic. There's no way that you can do this kind of procedure under a local anesthetic because it's just too painful and you can't get the local anesthetic to go everywhere where you need it to be. So you go to sleep. We use Sydney's best anaesthetists in a proper hospital setting so that you're absolutely safe. Your safety is our number one concern. Now, once you're properly anaesthetised, we'll tend to place in an indwelling catheter or a catheter to collect all of your urine. Now, the reason for this is for the first one or 2 days, you tend to be quite tight in the tummy, and we don't want to give you the inconvenience of feeling tight in the tummy and needing to go to the bathroom. So for 2 days, 1 to 2 days, you tend to have the catheter. You'll also have a drip in the arm. Now, as the operation starts, we take away all the skin and the fat in the lower tummy, and then we're left looking at the muscles underneath. So the muscles underneath, the rectus abdominis muscles, sometimes they're spread quite a long way apart. When they're spread apart like this is called a diastasis of the rectus abdominis. So we tend to sew all of those muscles down, all the way from your sternum, all the way down to the very bottom, and then back up again. Once those muscles are firmly sewn back together with a combination of dissolvable and non-dissolvable sutures, we're then in a position to start wrapping up the operation. So sometimes that involves some liposuction around your flanks and your upper belly, but we then place in the pain buster and then start closing the belly together again to give you that nice neat line that's hidden very low in your underwear or your swimwear. Now, you may ask, what happens to my belly button? Well, you end up with the same belly button, but the belly button gets placed in the same spot, but when we pull that skin and tissue down to the lower border there, your belly button needs to come out into a new spot. So we tend to make those belly buttons little innie belly buttons and then sew everything up with dissolvable stitches. Now, there'll also be 2 drains. Now, I don't know why some people are anxious about drains. Drains are one of the best things ever. The reason drains are fantastic is because they take away all the extra fluid on the inside of you. So if you can imagine, we've done a really big dissection on the inside, taken away all that skin and fat, repaired the muscle. What happens as your body starts to heal together is that often it will create fluid, and there'll always be a little bit of extra old blood around as well. Now, rather than that collect on the inside of you, it's really good if that goes outside of you so you don't get infections or collections of fluid or blood even. So the best way to do that is in a controlled environment with drains. So drains are nice soft silicone tubes that connect from the inside to the outside and are collected in these tiny little plastic bottles. Now, when the drainage output is less than 30 to 40 mils in a day, we can tend to pull them out. It doesn't hurt whatsoever and is over in about 10 seconds when we pull them out. So they do a great job. They take away all the extra fluid and stop you having to worry about getting needles sticking into your abdomen to pull out the fluid at a later stage. How long does the operation take? Well, that really depends on the size of your belly and what needs to happen. Usually it's anywhere in the range of about 2 to 3 hours, depending upon if we need to do some supplemental procedures such as a breast procedure or some liposuction at the same time. Your hospital stay, usually anywhere between 2 days to 5 to 6 days. If you're in a fund, it's easiest if you stay within the hospital, but some people who may be self-insured or not in a health fund will tend to stay 2 days in the hospital, and there is a fantastic 4-star hotel right across the road from us called the Boulevard Hotel. And we have a special plan so that anyone in that situation, they can get looked after by our staff whilst being in the comfort of a 4-star hotel, which is pretty good. Anyway, I hope that's been helpful as a brief overview of what's involved with the procedure as well as some of the post-operative stay. I hope this has been helpful. Any questions you've got, once again, don't hesitate to get a hold of us either on the app, internet, Facebook, social media, whatever you like. We're there for you. So I hope this is helpful, and I'll talk later. Bye.